Hello, I'm Stephen. I'm one of the hygienists at Dental Health Spa. I hope you're all keeping safe and well. What I'm going to do today is just run through some brushing technique tips with you and some cleaning in between, because now, more than ever, it's really important that you are cleaning your teeth really well and looking after your teeth. So what I'm going to do first is just show you an electric toothbrush. So we've got a Phillips brush here. So what you want to do with this brush is you just want to angle it, same with any other electric toothbrush as well, is angle it towards the gum line. So where the gum meets the tooth, you want to angle the brush at a 45-degree angle. So it's almost half on the gums, half on the teeth. And then you want to just turn the brush on and just count for a couple of seconds and just walking it along. Okay, so it's like a slide and glide technique, just walking the brush along towards the front, maintaining that 45-degree angle towards the gum line. You want to brush the tops of the teeth as well, which is really important, just working your way along the top. Same on the inside, angling it down towards that gum line, okay? So just working your way all the way right round to the front. And you want to be careful not to brush too hard, which I'll come back to in a second. With a manual toothbrush, it's exactly the same. So you just want to angle the brush at a 45-degree angle, so where that gum meets the tooth, and it's gentle circular motions. So you don't want to be scrubbing back and forth. This is a Curaprox toothbrush, which is quite soft, so they're quite nice brushes to go for. Gentle circular motions around the front, the tops as well, gentle circular motions, and then the same on the inside, okay? So angling it down towards the gum line, and you can angle that brush up just a little bit there when you come around the front. The tops would be the same with the electric, and the manual is again angling it up towards that gum line, okay? So you want to be careful that you're not over brushing too hard, because what can happen is if you're brushing too hard, you can cause the gums to recede and they won't grow back, and that can cause sensitivity. So what you want to do is you just want to be just doing a nice, gentle, soft brushing action like I showed you. A lot of electric toothbrushes have got pressure sensors on as well, so they'll alert you if they're, if you're pressing too hard. If you do get any sensitivity, you can use a sensitive toothpaste. So you've got Colgate Sensitive's really good, or you've got Sensodyne. They're also very good to use. You can also put a little blob on the tooth at night time if need be. When it comes to wisdom teeth, so now it's really important. If you've got wisdom teeth, they can be a bit of trouble if they're partially the way through. What you want to do is brush them with your normal toothbrush, your electric or your manual, and then just gently, you can use one of these interspace brushes, or single tufted brushes as they're known, and just you imagine this is the wisdom tooth, you just want to gentle circular motions, just sort of massaging around, just to sort of disrupt all of that plaque. And then around the back as well. So if you imagine you're just trying to get under the gum, there might be a little bit of gum flap there. So that's really important to remove all the plaque and any food debris, because that's what's likely to cause any infections or any swellings or any problems with your wisdom teeth. So now when it comes to cleaning in between the teeth, so we've got TP brushes. So what you can do is, the TP brushes, you can put the cap on the end, and it acts as a handle, which a lot of people don't know, and you can also bend these as well. So these aren't designed to be single use. You use these a few times, you just rinse it off and you just throw it away once it breaks, or once the bristles wear away, you throw it away. The TP brand come in different sizes, and the colour depicts the size. So if you do go for a different brand, which is fine, you just want to make sure you know the right size. So we would advise to use the TP ones so you know the size. They're the ones that we have here as well. So what you want to do is, you've got like a little triangle bit of gum in between the teeth, and you just want to gently push the TP brush through, just back and forth a couple of times, just like so, yeah, just in and out, and you can rinse it off as you go along. We've also got, TP have got easy picks that are quite easy to use. They're designed to be single use, but you can use them normally a few times. So my advice would be rinse it off and just throw it away once it breaks. You might get 2 or 3 uses out of it, but just see. And with these, they come in 2 different sizes. So TP do orange, which is the smallest, and blue, which is a bigger size. I'd recommend to start with the orange ones to begin with. And the same principle with these, you're just gently pushing them in between, just like so, back and forth. Just a couple of times in and out, back and forth, and that will just remove any plaque or any food that's there. If you do notice any bleeding, don't be put off by that. It's just a sign the gums are a little bit inflamed and they need to be cleaned a little bit more. So advice would be, to brush twice a day, once in the morning and once in the evening for 2 minutes, and spit, don't rinse. So don't rinse the toothpaste out, just spit out the toothpaste and then leave it. And then use the little TP brushes in between, either once a day, or you can use them twice a day. If you do notice any bleeding, as long as you're not forcing it through, it should subside after a couple of weeks. So it's really important at this time to take ownership of your dental health and keep on top of your brushing and your cleaning in between, especially now as the practice is closed. If you do have any emergencies, give us a call and follow the instructions on the answer message, or drop us an email and we'll get back to you as soon as we can. But I hope you're all well, keep safe, and we look forward to seeing you soon. Take care.